All right, guys. It's time for us to have a talk, and it's time for some tough love. And this message is strictly for my OGs, students who've been following me for a long time. They understand my personality and my delivery. If you are new to this channel or my page, please just skip this one. Go ahead and skip it. But I'm talking to the OGs, my nursing students. You guys are starting to get on my damn nerves. I do not understand how it is that you want to call the doctor so bad. You want to call the healthcare provider so bad. Do you not understand that when you're sitting down there in med-surg and OB and peds or whatever class you're in, or you're sitting down for your ATI exit or your HESI or your NCLEX, and you're looking at that question, do you not understand that the test writer understands that the healthcare provider knows what to do? They're licensed. They have their license. They're already a nurse practitioner. They're already a medical doctor. You're sitting before that exam because they want to know, do you know what to do? Why are you so quick to jump at call the healthcare provider? You want to do your job? Imagine you walk into your patient's room. You open the door and you see them doing this. You see them doing this. You don't say, Mr. and Mrs. Such and such, are you okay? That simple question, are you okay, is considered an assessment. Why? You want to see, are they able to say yes or no? Because if they're able to formulate that word yes or no, there's at least a little bit of air moving, right? So that's an assessment. You're not saying, are you okay? You're not sitting them up. You're not getting behind them and performing the Heimlich maneuver. You want to turn your back on that patient who's going like to call the healthcare provider. While they're going, you're on the phone with the healthcare. What do you think the healthcare provider is going to say to you? Let me tell you what they're going to say to you. What did the patient say when you asked them if they were okay? What did the answer sound like? What is the heart rate? What is the blood pressure? More importantly, what is the O2 sat? And guess what? You're going to be like, because while you're on the phone with the healthcare provider, the patient's in the bed. That's what you look like 98% of the time when there is something very obviously that you can do for your, and here's what's so crazy. This is what kills me with you guys. There's something that you can do first and it's non-invasive. The most simple, non-invasive thing to help your patient before calling the healthcare provider. You want to skip all of that to go call the healthcare provider while your patient. Stop it. You guys are getting easy test questions wrong because I'm looking at you guys argue in the comments and make up scenarios that are in your head because that's not what I'm looking at. I'm looking at the question and I'm looking at all the options, and all this foolishness that you guys are talking about is nowhere to be seen. You guys got to cut it out. All right. Don't say I didn't warn you.